A very good evening to everyone. A big thank you to Mr. Himanshu Khona and to Mr. Deshpande for organizing and inviting me to have an opportunity to speak with such an esteemed audience on a day when I'm sure people may have felt better staying at home and relaxing with the rains falling outside with all the heat that's been there. But I believe that the topic that we're going to discuss today will create a lot of interest and a lot of heat within each person with regards to recognizing what is it about health and happiness that we all seek, the ultimate holy grail. Now, as you all know from my background, I am a board-certified allergy, asthma, immunology specialist. I did my training at University of Illinois and University of Colorado in Denver, and I was in practice there for around 10 years. Last year, I left about 3 busy practice clinics that I was running with my partner in Vancouver, Washington, and decided to come back to my homeland. And it was probably the best decision that I ever made in my life. Because what I realize is that what India has to offer to the rest of the world with regards to its history of healing and of being able to provide a direction and a guidance is really immense and amazing. What I realized very soon, someone was asking me when they met me at the very beginning of this lecture, you look very young, how, we're not sure whether we can trust what you say. And very often when I was in the US and in practice, patients would come and say, are you the doctor or are you the training physician? And I said, just let me finish the visit. If at the end of the visit you have any questions in your mind, we'll answer it then. And nobody ever had any questions. I entered the portals of the field of medicine 22 years ago. And I have been in practice for around 16 years now. And I know I don't look my age. And for that, I have only one reason and one secret behind it, and that is keeping my interest alive in the field of medicine and keeping my interest alive in giving people what truly brings them to health and happiness. And that journey has led me through the entire cycle of mainstream medicine all the way to super specialization, at the point of which I realized that there was something missing. I had so many patients that we were giving the exact and the best treatment that was recommended in the latest and best literature, and yet we were not seeing results for those diseases. And the question that I had to ask myself from the very first time that I entered the field of medicine was, what are we missing? What is it that we are not addressing? The patient is doing everything we ask them to do. The medicines are the perfect and the best ones in the world. The diseases seem to match with what the description is in the textbook. Then why is it that the person isn't getting better? Right from a simple thing like anemia all the way to HIV or cancer for that matter. And what is it that we are missing? What is it that we are not addressing? And that circle and that question essentially led me to look at other forms and other sciences that go behind the field of medicine towards the human body, mind, and spirit. Interestingly, the World Health Organization, when it gives the definition of health, it says that it is not merely the absence of disease, but it is a healthy mind and a healthy spirit in a healthy body. So while the World Health Organization recognizes that health is not just the absence of disease, yet when we treat a patient in the clinic, I have 5-10 minutes, the patient has probably less than that. They have to be in 10 places at that same time. And in that time, I'm supposed to assess them, diagnose them, treat them, give them a prescription, send them on their way so that they can function and lead their life the way they want to. Now that's where modern medicine has left. Literally right now in the US, Walmarts, which are going to invade India very soon, are having what we call doc in a box. You go for your shopping, you enter a doctor's clinic, they give you a shot, they take your history, you're out of there, your shopping bag is ready at your checkout counter, you're on your way. That's where medicine is going. Do you really believe that any disease can ever be treated that way? Just ask yourself. If disease truly happens to be something that involves the mind, body and the spirit, I don't think that any of us would believe that it's possible to address that in that short of a time. And when we look at ancient medicine, we realize that with the Vedacharyas or the gurus or the acharyas that were there, just a visit to them, to have a conversation with them was often enough to heal and cure the problem that the person was facing. What is it in that that made the difference? The presence? The knowledge that that person had just by meeting them? The insight that the physician had? The confidence that the person had? The aura of the person? The healing energy of that person? Or was it simply being able to have someone who had a compassionate ear to listen to the problem that you had, and that was enough for you to find the solution to your problem right then and there? The power of counseling, which is hugely lacking in modern medicine these days. Patients often come to me as a super specialist. They've already been to an average of 5 to 7 physicians before they get to me, wherever I'm practicing in the world, whether it was in the US or here in the last year and a half. And the same thing that would happen is they say that, doctor, the time that you took to understand that was wrong, what was wrong with me, was often enough for me to find my own answers, because the questions you asked me had the answers within them of what I was doing wrong and why I was keeping on suffering. Power of counseling. Similarly, when we look at the aspect of mind and spirit, the part that's missing often, all of us, if we look at modern medicine and where our theories of modern medicine are going, you pick up any disease, ultimately they will wind it down to stress, tension, diet and lifestyle. You look at any disease for that matter. And to that you'll add an aspect of genetics, what you are born with, what you were given as your blueprint, as your DNA. On top of that, you add the environmental exposures that you're in, the diet that you're having, the stress or the anxiety or the pressure that you're under, and you end up with different manifestations depending on where your genetic deficiency lies. Now, this is very easy to understand, but what do? You can understand the genetic defect. You can probably even develop gene therapies, which is going on widely around the world. All these things you hear about stem cell transplant and all these are basically manipulating genes. But beyond that, the part where you look at mind and spirit, that's where the role of stress and tension comes in. Even in a recent movie that some of you all might have seen, Vicky Donor. How many people here saw Vicky Donor? Several people here. What does he say is the reason for growing infertility, for couples' inability to conceive these days? Stress. Isn't that funny? I recently did an article in Life Positive. In the month of July, I was interviewed, where I went through all the different causes for the reasons why infertility is growing in India. One of the last places in the world where you would expect this to happen, with the highest population that we have, but it is growing. 12 to 15% of couples these days are having a hard time conceiving. When you boil that down, it comes to stress. Now, interestingly, we all think of stress as psychological stress. Stress is not just psychological stress. Think of it this way. You have physical stressors. Just the temperature fluctuation that your body goes through in a day. It was really scorching hot this morning, and it's cool and raining this evening. That's physical stress. You travel in a train or a bus in Mumbai, or you just drive through traffic in your excellent car. That is stress. By the way, in Los Angeles, they've connected 4 hours of driving on the busiest highway with heart attacks. Well-proven study, reproducible study. Physical stress. Mental stress, we are all familiar with. Pressures, deadlines, it's a child, school examinations, keeping up with peers, friends. For grown-ups, it's family, achieving different goals in life, mental stress. Psychological stress. Beyond that, you add chemical stressors. The adulteration that we are facing in our food, in our diet, in our water, in our air for that matter, chemical stress. Physical, mental, psychological, chemical, emotional stress. We all recognize that. Stress that may come just through a simple relationship that we would expect to be the smoothest in the world. But still someone said something and it becomes a very big deal. Takes away sometimes hours, if not days of our routine, just worrying about why did that person say what they said, when they said, and how they said it, and in front of whom they said it. Emotional stress. Now add to this spiritual stress. Baba Ramdev comes every morning and says, wake up in the morning at 5 o'clock and start doing pranayam. And then you say, I can't wake up that early, I already have a very busy schedule after that. Spiritual stress. Need to do yoga, need to do pranayam, need to do prayer, need to do meditation. When will I do all this? So when you look at the types of stress, it is not just one stress. And so when we look at disease, where the normal equilibrium in the body is getting disturbed, we have to look at all these aspects. And this is what I found I was missing when I was treating patients. I was treating the physical aspect. We know in modern medicine, down to the very gene, to the very chemical, to the very cell that is abnormal in almost every disease today, except a few that are still enigmas to us, but they will be unraveled within the next 10 to 20 years, for sure, with the human genome mapping that's going on. But we still don't have an answer as to why that chemical disturbance occurred. Why did that cell go haywire? Why did that cancer cell lose its control that it started multiplying uncontrollably, and no medicine, no radiotherapy, no chemotherapy in the world could make it stop? Why did the immune system fail so that it could not keep a surveillance on that cell? Why did the allergies or the asthma develop? Because of the lack of immune surveillance and balance. And that is where I realized that there is an esoteric part of medicine. We were talking a little about physics with one of the group members, and I told them that quantum physicists who are trying to find answers to the universe, where did the world come from, what is energy, where does it come from, they are now coming and meeting with doctors, and doctors who are doing the highest form of research on the brain, looking at brain waves and energy waves, are coming together and realizing that it is one universe, one world, one connected, live, breathing organism of which we are a living, active part. And when we get disconnected, that's when disease arises. We get disconnected at many different levels. The most extreme level of which would be an example like depression. A very big rising disease in the city of Mumbai today. Depression, anxiety, panic anxiety, disconnectedness with our environment, disconnectedness with the energy fields that are around us. And these energy fields are not just influenced by what we are doing, but also by what we are eating, because we are what we eat. It's getting influenced by our thoughts. It's getting influenced by our actions. It's getting influenced by our perception of what is around us. And that energy is what I realized is the untapped answer to a lot of diseases and problems, for that matter, not just physical, emotional, psychological, related to relationships, related to spirituality, or any other aspect of life that you consider. Now, interestingly, people have been asking me, am I going to be talking about Reiki? Reiki is a word that we know comes from a Japanese word. It means universal life force energy. Okay? Mikao Usui used that word when he, through his meditations, identified that there was such an energy that could be channelized through a person to heal themselves and to heal people around them, and for that matter, to heal the universe around them. But interestingly, when you look back at India and its history, our gurus, our sages, our sons knew about this energy tens of thousands of years ago. I'll give you a simple example, a pratha that is very prominent in India of touching an elder's feet and the elder putting their hand on their head. The earliest form of Reiki ever described on the face of this earth. Because when that person puts their hand on your head, what they are wishing from their heart chakra, from their heart center, is that you be happy, you be successful, you be blessed, you be able to do what you want to achieve and do in your life. The earliest form of healing and Reiki that was ever described. Our gurus were already doing it for thousands of years. But we had to learn about Reiki from a Japanese man. And we got really carried into it and learnt about it and felt that, wow, that's the best way of healing that we have. But what I'm saying is we had healing long before that. Healing of words, healing of actions, healing through other aspects of our day-to-day life. Food as medicine, like I keep saying again and again. A huge chemical stressor on our body, like I said, is the adulteration. Recognizing that, removing that, gets rid of half of the diseases in many cases. I get patients with arthritis, I just go through their entire diet history, remove a few things from their diet, automatically their arthritis reduces by 50 to 70%. I don't even prescribe them a painkiller. The most common prescription that you'll get at a doctor's office is a painkiller, or a sleep medicine, or an anti-anxiety medicine, or an antibiotic, or a cough and cold medicine, or an allergy medicine these days. When in reality, many of these energy imbalances that cause these diseases in our body can be self-healed. So when I recognized this, I started feeling that I really need to go out and tell people to recognize and understand that they have the answers to their problems within themselves. They have the healing power within themselves that God has gifted each and every one of us with, but we have gotten so disconnected from it with our highly logical education system, including me as a doctor. I admit it. I don't regret it, because I think what I learned in medicine will help me for the rest of my life. My 15 years in the US will always stand me in good stead forever. But at the same time, recognizing what I was missing was very important. Because once you invoke that same energy within you, that same healing power within you, then every disease becomes very simple to resolve. For that matter, every relationship, every surrounding, every event becomes very simple. There was a very interesting study, if you all are thinking that the topic of energy is esoteric, in Harvard University, not very long ago, there was a very interesting study done, where they literally took a group of about 250 people who believed in meditation. As you can expect, not everyone quote unquote believes in meditation these days. So they took about 250 people in a city and they decided to put them together, and they said that for a certain amount of time, every single day they would meditate at the same time for peace in their city. One of the most violent cities in the world with the highest crime rates, Baltimore, Maryland. For 1 year, these people meditated every single day at the same time, wherever they were sitting in the world. They just committed themselves to meditating for the peace, for the happiness, for the success, and for the joy of Baltimore, Maryland. And they actually showed, by tracking the crime rates from the police stations and the hospitals and the other areas, that actually there was a decline in the crime rate, a very obvious decline that could not be explained by chance. I'm saying leave that part where you're trying to heal the entire city for later. Work on yourself. If we learn the art that we've forgotten again, and we do a lot of camps, Himanshuji's attended quite a few of them, and I would invite each one of you all to either hold or organize a camp or attend a camp where you realize how you can invoke these energies. Don't call it Reiki if you don't like the word. You can call it anything you want. Call it energy healing. Call it universal life force. It's all around us. My voice coming to you is a form of energy. You seeing me is a form of energy. This fan is running on energy. We can't see the electricity that drives it, but it's very much there. You touch a live wire and you'll get a shock. Energy. It's all about energy. And recognizing that, invoking that within yourself, so you can start by healing yourself. And once you see the power, once you see the results, your faith and trust grows, and then you realize you can do a lot more than that, whether it's with your children, with your family, with your relationships, with your work, with your business. No aspect of your life will be disconnected once you get connected. And for this connection, there are many aspects of our health that have to be addressed. Right from our diet, so that the right energy, because ultimately what we are is the energy that we gain from our food. If our food isn't right, the energy that we have within ourselves won't be right. So right from the food, to the water, to the thoughts, to the images to what we see, what we interact with, what we do, all the way to the actual act of healing yourself, everything included is something that we can become aware about, and with that awareness, healing will follow. So this becomes the energy part of the healing. I think everyone here has a fair understanding of what I'm saying. Going to the next step of this, what I realized through my last 16 years of practicing medicine is I also saw that in allopathy, any disease that you can pick up, our entire goal and purpose in that disease is to suppress the symptom. You come in with a headache, I give you a pill that is suppress the headache. You come in with acidity, I'm taking the most common problems that patients face, okay? You come in with acidity, I'll give you a medicine to suppress the stomach acid. You come in with any other problem that you can think of, other than antibiotics that actually get rid of the bacteria and the infection, most other medicines are either designed to control or to suppress. There are very few things that I realized in medicine actually work on curing a problem. And you look at most chronic diseases these days, hypertension, once you get it, doctor says take this pill for the rest of your life. Otherwise, do exercise, think happy thoughts, don't take stress, eat well, take a walk every day, which becomes impractical for most of us in our busy, hectic, modern day stressed life that we live. Okay? So pill for the rest of your life. Thyroid, pill for the rest of your life. Heart disease, pill for the rest of your life. This thing to thin your blood, this thing to reduce your cholesterol, this thing to do this. No escape from it, no outlet, no way to end it. My patients ask me, I'm an allergy, asthma, immunology specialist. I treat babies who start with eczema at 2 weeks of age. I treat people who suddenly have a food allergic reaction after eating the same food for 50 years of their life. One fine day they eat it and they almost die. And they come and ask me, why did this happen to me? And will this be with me for the rest of my life? And how can I come out of this problem? And these are questions that even modern medicine sometimes can't answer. And so the question that came up, what is it that we are missing, that the root cause of the disease is not being identified and not being cured, other than gene therapy? And even in gene therapy, I'll tell you, as an immunologist, because the immune system is affecting every single organ in the body, no disease can ultimately be, shall I say, enacted without the immune system acting in that role. Right from a heart attack, they have shown the immune system is involved, to cancer, to HIV, and to a simple cold or a virus. And in that, what we realize is that there are some deficiencies, some defects, some toxins that build up in the body that cause these areas or these problems to persist. And so with these very, very young patients, very, very young children getting the same question again and again, how long do I take this medicine for? When will my child be able to stop this medication? Or an adult saying, when can I stop this inhaler? Will I get addicted to this medicine? When in reality I tell them it's not an addiction to the inhaler, it's because your disease hasn't gone away, your body can't work without the inhaler. It's not that you're addicted to the medicine, it's that your body can't function without the medicine, that you feel that you've become dependent on it. And so coming out of this dependency is another thing that I did a lot of research in. Looking at many ancient healing arts, Siddha Sanjeevani, Ayurveda, Unani medicine, Tibba, Greek medicine, Japanese healing arts, came to realize that these forms of healing have actually gone to the root of the problem. For example, a disease like migraine, we know the latest and best research that there's a defect in a receptor in the brain that does not function properly, a chemical becomes imbalanced, and the blood vessel there first constricts and then dilates and causes a throbbing headache. One so bad that a person can sometimes lose 2 days of their life lying in bed with a closed room because light affects them, sound affects them. All of modern medicine treats migraine at the level of that circulation in the brain, when in reality the defect lies in the gastrointestinal tract. But modern medicine cannot make that connection yet. They're working on it. They've figured out that we tell all our patients to avoid certain foods that we know increase a certain imbalance in the body. But we are still not making that connection that the imbalance is in the gut. Same way with allergies, I'm giving pills, I'm giving sprays, I'm giving inhalers, but the problem lies in the immune system, and 80% of the immune system is in the digestive system, the central ministry. So getting true guidance from someone who understands what you're eating, why you're eating, when you're eating, how you're eating, in what combination you are eating, the whole art of Vipreet Ahar that was well known in our ancient medicine is a lost art these days. In the age of breads, cakes, cookies and biscuits, what goes with what, when and how, what should be eaten when. I'll give you some examples of how modern science sometimes misleads us. A simple statement like the sun rises in the east and sets in the west. We all accept this, right? But does the sun really rise and set? Same way an apple a day keeps the doctor away. Everyone's heard this? But the reality is that if you eat the apple at the wrong time in the day, it will cause a far worse problem in your body than it would if you ate it at the right time. In fact, the type of apple that you eat, where that apple has been grown, because that affects the energy in that apple. And does that energy match your energy and your body's needs and requirements? Will determine whether the apple will do good for you or not. I get so many cases of ladies, and mostly ladies, with chronic anemia. They are taking dozens and dozens of milligrams of iron every day, eating apples. Still the anemia won't resolve. No doctor can figure out what's wrong. Every possible has been done. Where are we going wrong? Look one step beyond the physical body. That's what I realized as a doctor. There are 7 planes to a human being. The physical is only the first plane. We are a very magnetic organism, the most evolved of our kind on this universe, in this planetary system, if you want to call it. And recognizing our connection and how we are influenced by everything around us is really the key to finding the answers to whatever it is that we are faced with life. Even if we are healthy, what we call healthy, no disease, but then the mind, body, spirit being happy becomes the next question that we ask ourselves. And so with that, I will, in the nick of time, conclude, give some time for questions that may come up. And what I would urge you all is, with the work that our team has been doing, like I said, even as I was in the US for the last 4 or 5 years of my staying there, I had started conducting these, what we used to call stress-busting workshops there. We call them happy living camps here. We have different names for them. Prayer healing camps. There are many ways to invoke the energy within you. Prayer again is one of the simple example of what we all learn right from our childhood as the most common way of connecting with something that is much bigger than ourselves. That's also healing. Healing begins from them. We are already doing it. We just don't know the potential that we have. It's immense. It's infinite. And that is what I enjoy bringing people to recognize about themselves, experience it in my own life, and spread the word around so people can also experience the kind of inner joy, satisfaction, equilibrium, harmony, if you want to call it, within ourselves, no matter what we are doing. I feel that I became 100,000 times a better doctor after I started getting into all these fields. It's not like I have given up my modern medicine. I still keep up with the latest and best in every field, even beyond my field. But now I find that with the form of, with the approach that I have, I find that I have more energy throughout the day to achieve everything that I want to do. I still counsel my patients in the US. I have patients in Canada. Patients come to me from there, still new patients. They come from Dubai, from Singapore, other areas in Middle East. I do online counseling. So I do my entire work through the day, come home, rest for a little while. Again, my session begins. I continue till around 11, 12 at night. And still I wake up every morning around 6 o'clock and start the day again. And the only thing that keeps me going is that connection. That energy healing that I have decided to wake myself up to, and I would urge each one of you all to wake yourself up to, so that you all can experience the same kind of endless power, if you want to call it, to do whatever you choose to do. Be the best mother, the best father, the best businesswoman, the best employee, the best whatever it is that you decide is your goal in life. No one has to decide that for you, because each soul sitting here is on its own unique journey. Yet we compare. Big form of stress, by the way. iPhone 2, 3, 4, 5, 6, 7. Need to get that now. Do you really need it? Don't you feel that life requires regular checkups? And that's what this talk today hopefully will make you all do, is sit back and think about the things that I've told you. I've actually covered on at least 40 different topics within the last half an hour. And very brief time, I can actually deliver lectures on each of these topics at length. So I would hope that we would have, if there are any questions, I'll be happy to take them now. Any specific questions, I would urge you all to come and speak with me later. I would also have my assistant, Dr. Mridula, share some of my information. If people want to get in touch with me for any reason in the future, they can do so. And I would hope that in the future we would have an energy healing camp, and we would do specific camps dealing with health issues that people can come to and address those, right from simple anti-aging, a living example of that. I had really aged myself very heavily by the time I was 30, very heavily. By pushing myself, working long hours, staying awake till 4 a.m. after doing a full day of work at the hospital, keeping up with research, doing bench research, doing clinical research, writing papers. Ultimately, I had to step back and look at what I was doing with my life. And when I reconnected myself, I was able to do all those things, but without destroying my health. So every time someone gives me a compliment that you don't look your age, I have passed 40. I have passed 40. I know. And that's what I say. Every single person till the last day of their life should be active, functional, and doing what they choose to do. That is the best life that anyone can ask for. And that is my wish and prayer and hope for every single person. Thank you.
So we have 5 minutes for questions.
First question will be mine, sitting closest to you. Because one of the points you touched on really affects me. I've had a heart surgery, bypass, before. Not mainly personal. The general question is that if there is a genetic issue, like body producing more cholesterol than it actually needs, and result of which then it was not contained and was artificially added on because of the external influences and stress and all those put together.
Correct. Diet, all those things.
Just the doctor said, well, you need to take Storvas 80 for the rest of your life.
Correct.
Ecosprin, Storvas 80,
Correct.
Amlogard 5 mg, whatever.
Correct.
Right? And I also take fish oil tablets coming from US.
Correct.
So, you mean to say that there are techniques that if you are able to invoke the energy within yourself or the self-realization to take care of this genetic disorder?
So this is a very good question, and the answer to that question is absolutely yes. That what you have to realize is that with any genetic defect that leads to a disease, it's ultimately not the gene alone that is causing the disease. There's always a diet, lifestyle, and environmental factor that has to come with the gene for the disease to manifest. Now, while there is no way in the world that you can actually alter the gene unless you have done very advanced forms of sadhana, where people have been able to change genes also, definitely through self-realization, actualization, or understanding yourself better, you can certainly fix the diet, lifestyle, stress, anxiety, pressure, chemical adulterations or physical adulteration, all those aspects, so that this gene will not manifest its full potential of disease in your life. Okay? Now that would be before the problem occurred. Now after the problem occurred, what do we do now? So in that situation, we've had many cases, not just with heart disease, but also with diabetes, with other forms of chronic disorders, hypertension, where a person, after they have started doing the natural therapies that we do in our field called Jeevan Sanjeevani, along with our field of meditation through the organization that we work with called NIRA, Neo Independent Reiki Alliance, we have been able to get people off insulin, 60 units per day. That's a very high dose. We've been able to get people off their antihypertensive medications. We've been able to get people off their cholesterol medications. You name a medicine, and if the person truly, this is the key, if the person truly wants to be free from that disease, yes, there is a solution for that on the path of energy healing, on the path of natural therapy, 100%. Right from epilepsy, for which you would expect that there would be nothing that could be done because the circuitry in the brain has gone wrong, all the way to a hole in the heart, I have seen healed without surgery. That even the cardiologist was shocked, asking, how is this possible? We were going to operate you in a few weeks or in a few months, or probably should have operated on you a few years ago because you already have pulmonary hypertension or have developed other complications of a hole in the heart. And that has been healed. For that matter, people have come to us with 90% block in their arteries, and they've said that I absolutely do not want to have surgery or put a stent in my heart. Can you do something for me? My answer is yes. How badly do you not want to have surgery? That will determine whether I can get you out of that problem or not, but the answer is absolutely yes, categorically.
Okay, anti-aging, come on, this side.
A fantastic topic, anti-aging, really a fantastic topic, amazing amount of work, because again, when you look at the process of aging, what happens is the genetic material within our cells, they have a certain amount of, let's say, a lifespan. It's almost like a car. It's been given so many hours of a battery, or it requires regular servicing, and if that servicing is not done, the car will deteriorate. Same way, we found that in the process of aging, there is a section in our cells that determines how many more multiplications that cell can make. And when it reaches its maximum and too many toxins build up within that cell ultimately gives up and dies. If you can get rid of those toxins, do a detoxification process, anti-aging happens by itself. We do that day in and day out with the people who come to us and truly want root cause therapy with us. That's the first step that we do. It's a 15 or 20-day process that we put them through, doing whatever it is that they're doing. They don't have to walk off to an ashram. They don't have to go and give up their daily routine. They're doing everything that they normally do. We ask them to give themselves 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes at night. That's also probably an overstatement. 5 minutes would be enough to take the things that we give them, but it is customized. Every single process of anti-aging that we do is custom made for that person, because no two people are same for us in the field that we work in. No two people are same.
Do you mean to say most of the operations are not necessary, like transplant of kidney, heart bypass surgery? I had 22 years back. I am okay, otherwise I would have been up somewhere.
Absolutely not. Otherwise, I would have given up modern medicine, right? Modern medicine has a tremendous role in where it is, and there are, I would say that 99.999999% of the world is going to require modern medicine at some point in their life or not. So I'm talking about any disease for that matter. You specifically take the answer for surgery. I'm saying that every disease gives you, I didn't touch on that topic today, every disease gives you many red flags and signals that we choose to ignore because we are so disconnected from our body, from our mind, and from our spirit. If the person were to awaken themselves and pick up those signals early enough, I am a total believer that every single surgery in this world could be eliminated and avoided. So that's what I'm saying. I do, and that's why I said it's possible, but I said 99.9999999% people in the world are going to require what you are saying. But what I'm saying that even if we picked up a small amount of what we could, suppose a person was destined to have 5 surgeries, maybe if they understood what I said from this lecture and applied it in their life, they may end up with 2, is what I'm saying. Not every surgery is avoidable. Now you will say that I know because I'm a pediatrician also by training. I take care of everything. I say I'm a doctor from womb to tomb. You know, right from delivering babies and taking care of newborns, I've done it all the way to the geriatric age group. That's been the blessing of the fields that I've chosen and the places I have trained at in the world, okay? Some babies are born with defects. You would say that with a congenital heart disease that a baby is born with, isn't surgery required? 100% required. But if that same surgery were occurring in a person when they were 40 years old, and they had a chance for 40 years to give a small portion of their energy and attention towards understanding what is going on in their body, finding the doctor who would do the right test at the right time, preventively, identify problems, give the right solution to it, it's very possible that at age 40 that surgery could be eliminated, is what I'm saying. So surgeries are required. I take care of transplant patients. I'm an immunologist. In fact, I take care of the immunology. After the surgeon puts the organ in there, it's my role to make sure that that organ doesn't get rejected. So I know everything about immunology and transplants that is there on the face of this earth. But what I'm saying is, my purpose and my goal of standing here in front of you today is not to let you reach that stage. So what I'm saying is, wake up. If you ask the right questions, every doctor will be forced to think about what I'm saying. I, in fact, go and do this same lecture with groups of doctors, and you cannot imagine the type of discussions we have there. It's like almost sometimes it's the most amazing thing because everyone agrees with me, and sometimes it's literally, going to be a battle in the room, but ultimately we all calm down and we all agree that we are doing the best that we can individually, whatever we have learned and whatever our skills are. Nobody's heart is in the bad place. Every doctor is trying to do the best that they can. So I don't have anything against the doctors who are not doing or don't understand what I'm saying. But what I'm saying is that every person in this room is an esteemed individual in society who has a tremendous force field around them that they can influence. And that can only happen if each person awakens. Forget about finding the right doctor. What I tell my patients, because I told you I get people from all over the world. I say, when you ask the right question and you seek the right answers from him, her, whatever you want to call up there, he places you in front of the right person. When the disciple is ready, the master appears, they say. Same way, when the patient is ready, the doctor appears.
Doc, I have one. You have
Yes.
to answer in one word.
Sure, one word, wow, okay.
How many glasses of water one should have in a day? What is it? I mean, generic, which is one, but typically.
One answer, huh?
Okay, you can have 2 words, no problem.
I'll give you the common medical answer. 6-8. 6 to 8 glasses per day, okay? Now let me please, I know you want a 2 answer, but I cannot let go with that answer. Please, that's just against my core. Every single individual is so unique. I know people who have just 3 glasses a day and are doing fantastic, and I know others who drink 2.5 liters a day and still have problems. So please don't take my answer as a generic, but 6 to 8 is generally what modern medicine says. When you have it, how you have it, before food, after food, all that makes a huge difference also. Temperature of the water too.
Okay, how many hours of sleep in a day? Do you recommend?
8 hours average for an adult.
Okay. Is moisturizer good?
By the way, when I say 8 hours, it doesn't just mean, because I have a lot of people who have a 5 lakh rupee bed and they lay in it for 8 hours, but they get zero amount of sleep in it. Okay, so we are talking of 8 hours of restful sleep. Otherwise, you could sleep 14 and still be unrested, and you could sleep 4 and you could be amazingly rested in the world.
Okay. How about moisture is good for skin? Keep you looking.
Is moisture good for the skin? Moisturizer good for the skin? I think now we are transgressing into personal questions. Okay? No, it's okay. I'll take that question. I told you it was getting personal now. I could tell. See, it depends on what atmosphere you're living in and what your basic skin type is. See, there are some people who don't retain moisture in their skin. Others retain moisture beautifully. I know people who don't need a moisturizer and will never need it in their life. And I know others who need it 3 times a day, otherwise their skin will look like a snake skin. So there are extremes to that. It varies. In a city like Mumbai, we already have an average of 50 to 60% humidity year round. So under ideal circumstances, no moisturizer should be required. But then we use such harsh soaps, such chemicals, such perfumes, such kind of stuff we are exposed to that we end up having need for moisturizers. So within that also, in our natural field of Jeevan Sanjeevani, we have a lot of options that we give people.
Great. Is crying good for men?
Crying is good for every single person. Every single person, child, woman or adult. Because in fact, through our NERA seminars, we do certain processes that are very important, what is a process of emotional freedom techniques. Emotional freedom technique is so critical for every living human being, because you just take an example, don't look far, look at your most immediate, quote-unquote, loved one. If you think hard enough, you'll be ready to take out a knife and stab them sometimes. Am I lying? And so when we suppress that feeling within ourselves, we get so angry on our spouse or our child, we want to beat excuse the word, crap out of them, but we can't do it. That suppressed energy, that suppressed emotion will also translate into disease in the future. In fact, all hypertension research is now going down to suppressed anger. All hypertension research, best universities in the world. Okay? So crying is good for everyone. Till you realize why you're crying, what you're crying for, and what you're trying to release through your crying, till then crying is good for everyone. If you go long enough and far enough in the field of spirituality and healing, you will realize that you don't need to cry. But before people reach that stage, it takes time to reach that stage, crying is necessary for everyone. Even if it is in a closed environment, when we do our sessions, people can't see each other.
My wife is very happy to hear.
Okay, I see some figures actually. Okay, I got your question. How many drinks is safe to have?
I already answered it, 6 to 8 glasses of water a day. What do you want me to say after that? The American Heart Association, you'll already know this answer. American Heart Association says 60 ml. 60 ml. And you know what the reason and the science behind that is? What's that? You know, if you go into that, there are so many technicalities, They have said it more so for wines. But people replace it with hard liquor. Then they replace it with beer. Is this also applicable for beer? This is also applicable for hard liquor. We put what we want in our mind, for that matter. There is no end to that. They did their research based on red wine for heart health. Red wine for heart health. Now you ask yourself what you're drinking, why you're drinking. Is the reason because American Heart Association said so? Or because you actually enjoy it and you like to get your stress released? Because I truly believe that the reason why alcohol works with people is for those people who haven't learned the stress release phenomenon, the way to reduce their stress, they go to alcohol to reduce their stress. There's nothing wrong with it, no harm in it, no damage, as long as you stay within the limits. But at the same time, if you find the root of it and you treat it, you won't need the 60 ml. of whatever it is that you choose to drink.
Okay, one last question for Mama.
How many cups of tea?
So I can't say no.
My answer, everyone can see my answer. Now look at it this way. It's up to you what you want to interpret. For me, 0 cups of tea a day is okay. Because the tea, the way we drink it these days, the tea that we boil, brew, put milk into, the one that comes that is roasted, boiled, burnt leaves of tea, has no nutritive value in my books. I don't stop my patients from drinking it, but the ones who are having 5-6 cups a day, I tell them to reduce to maybe 1 a day, at the most 2. If they can give it up and replace it with a healthy tea, in Jeevan Sanjeevani we have 75 varieties of teas that we give according to the person's body type. And that tea, you can have a tea before breakfast, a tea after breakfast, a tea before lunch, a tea after lunch, a tea before dinner, a tea after dinner, a tea for fun and for snack. We have those many teas designed, but those will not damage your health like Brook Bond Red Label or Wagh Bakri Chai will.
Can I ask one question? Last one?
Yeah, sure. Last.
And you are saying that you give a lot of advice to people, to patients. How practical or easy it is to maintain after they leave you, after you have given that advice, to continue with whatever you have suggested?
So, sure. So what we do when we actually counsel someone who comes to us for therapy, we may give them the ocean, but out of the ocean, each person fills their cup and goes away. Whatever is relevant for them, whatever is appropriate for them, whatever is practical for them, if they can just apply that much in their life, they will be far better off than they were before they met me or anyone in my team. So for that matter, I may give you 100 tips. Out of that, you will in your own mind determine that tip number 1, 20, 35, 70, 90 and 100 are applicable to me. I can do this. Do that much is what I tell my patients. Don't try to do everything that I ask you to do, because it may not be practical and it may not be required for what your journey may be in life at that point of time. If it is, then follow everything we say. The people who follow everything we say ultimately come and join me. They become part of what I do. Because they find that this is the way to live and this is the way to do, and we travel the world and we do everything.
While you were talking, I just read in sometime back in Harvard Business Review that, why some cases the same medicine works and in some cases it doesn't work. The research that is going on is that body has a certain number of enzymes, and if that enzyme is missing in a particular person, then it will work or it will not work. So that's a different field on which work is going on. Would you like to? Sure.
This is actually the future of medicine, what you're talking about. This is what we call pharmacogenomics. In the future, when you enter a doctor's office, it may not happen right now. It's happening in the field of psychiatry the fastest, but it will eventually happen in the field of cardiac medicine and every other field of medicine. You'll go to a doctor, and if he's a smart doctor who keeps up with modern medicine, before he writes you the very first prescription, he will draw your blood, send it off to a lab. The lab will analyze a set of genes and give him the answer about which medicines will work for the person and which medicines won't work for the person. This is called the field of pharmacogenomics. This is why certain medicines cause serious side effects in some people and work like water for other people. This is the answer behind it, because the person who had the serious side effect was missing the enzymes to metabolize that drug, hence it became a toxin in his body, and the other person had the perfect enzyme system to work with that medicine. Same thing, why doctors have to keep changing medicines with people these days. They keep trying this, okay, didn't work, then this, that's called shotgun therapy. Shotgun medicine. 4 things we'll start, then we'll cut one at a time, see which one still keeps in control. Shotgun therapy. But in the future, we are going to do smart medicine. 1 sample of blood, send it off to the lab. Labs gives us the answer if it's a heart patient. Okay, these drugs will work for this person, these drugs won't. Psychiatric patient, this person, drugs will work for their depression, this won't. They have arthritis, these pain medicines will cause side effects, these won't. And then we'll prescribe the medicine at the next follow-up visit. But that form of treatment is not anywhere in the near radar in India yet. It's going to take, I would say, at least 10 to 20 more years for it to become commonly available. But already labs are starting to offer it with the help of foreign labs.
There is a question. Children often, most of people have got eye problems. So do you
Eye problems, you said, right? Yes.
So do you think working with energy levels, like you said, could avoid eye problems?
100% yes, the answer is again. Because, yes, I am a living example. When I first got into this field, I had eyeglasses number that were 3.75 and 4 in my eyes. Today that number has progressively gone down, and it's a miracle for my optometrist that I go to every time, and he says, no one at your age ever has their eye number decreasing, it's always going up. What is it that you're doing, your numbers going down? I'm right now at 1.75. I can often function without my glasses if I choose to. I don't, because I like to see expressions on people's faces. That's the only thing that I miss if I don't wear my glasses. But yes, for a child, we have amazing therapies, right from things that can be put into the child's eye, natural things, to energy healing, hands-on healing, and other techniques that can prevent them from getting eyeglasses, that can prevent them from getting, younger and younger people are getting cataracts in their eyes, from getting glaucoma, which is increased eye pressure, from getting retina detachment that is becoming more and more common these days, from getting floaters in the eyes that are very common in many people who have eyeglasses. Many things can be treated, and we have a whole range of natural supplements for those people, both to take by mouth and to put in the eyes, as well as from the healing standpoint, if all they want to do is the healing part. Both of them work very much. Dr. Mridula is a living example. She used to wear glasses before. Today she functions without glasses 100% of the time.
Doctor, I don't wear glasses. I'm 18. I don't wear glasses reading or seeing you.
Kudos. Some things that you did right in your life.
Can we take last question, please?
Yeah, you better decide that. Starbucks is about to enter India.
Yes. Life and death.
To me, I'll give you a genuine answer. To me, tea, coffee, these are all medicines. Okay? Coffee has health effects in your body. We use coffee in some of our therapies also. If you have a body type for which coffee is right, then coffee is okay. But the way people have coffee these days, which means that they can't start their day without one, and they can't go through their day without two, and they can't finish their evening without one for relaxing, that I don't think is right in any form of medicine that I know of.
No, I just asked this because the Starbucks is coming.
And I also have enjoyed many varieties of coffee in US, right from Seattle coffee to Starbucks coffee. And like I said, if you're having it for fun, once in a while, go for it. If it's a habit, think twice about it.
Okay, good, thanks.
Okay, on that note, that was Dr. Roy, MD, MBBS, MD, and so many fellow memberships of so many distinguished associations. We are honored to be here. To be with
My pleasure. I really enjoyed it.
all of us. Thank you
By
so
the way,
much.
this is one of the most oldest and most powerful ways of healing
Yes.
also. Just human connection, the energy that flows between two people, again heart to heart, that's where healing begins.
And this is special from all the Rotarians who love that 60 ml answer. This is to my friend Himanshu. I didn't acknowledge him. He is my old colleague from Net Magic. He is with Doc and doing a wonderful job here. Thank you so much. I really appreciate that.